tuned to a very important topic on dentistry as a career. We have our guest here, Dr. Funmi Sijuwade, and she's been telling us a lot. So if you're just meeting us halfway, you would like to rewind, go back and watch what we've talked about. One question: how does technology play a role in modern dentistry, and how do you stay up to date with the latest advancements?
Well, technology is becoming the core of dentistry, actually. So, for example, I haven't used pen and paper strictly in taking my notes or doing my charting since 2005. And I, since then, have been using digital x-rays as well. And there was a time when I went into a practice and they were not using the digital x-rays, and it freaked me out because it's like, oh my God, I have been so and probably I'm one of the ones that have been using it for that long. But now most practices are digital. There's something called digital dentistry, this advent of digital dentistry that is taking over. So we use technology has taken, is a core part of dentistry, and it's made the job, I wouldn't say easier to an extent, but also it's made us get more, it helps us to get better results in what we do as well. So instead of taking impression, which people call a mold, when you go in and say, oh, I need to take a mold of your mouth, you need a crown, I need to put this material in your mouth. We have digital scanners now that just scans it. And instead of posting the impression to the lab, the digital scanner gets uploaded in the lab pretty much seconds after you do the scanning. So that has really helped. And that helps with outcome because digital scanners will take a very good, precise impression of what you're trying to do. And technology has also helped us, especially in a cosmetic dentistry where a patient can come into the surgery and you can show them before and after. Then they want one or two things done and they're not wondering what would it look like. Scan their teeth and say, oh, I can show you before and after. This is what it's going to be like, things like that. So technology has done that to the clinical aspect of what we do, and also to the administrative that we do. Instead of writing appointments in a book or a sheet of paper or a booklet that we used to do back in the days, we have computers for that. So we take it, we have appointment books. I do all my notes on the computer. I don't write on pen and paper. I do all my notes on computer, and it's saved. And you're not worried about, oh, is it gonna get in the wrong hands, confidentiality, because everything is password code, is password protected, so nobody can just get in there and, like pen and paper or paper that, somebody else can, have access to if you don't lock them away. And it's made that also that easier in the sense that I can then, storage, for example, is done a great deal for storage. You don't need all these big cabinets to store notes in. It's done a lot for the environment as well. So you're not writing on paper and shredding and things like that. So technology has done a lot. It's you can do a lot. I can't even say it enough. How technology.
And just a question, I know years ago when I was having my children, pregnant women were entitled to free dentist appointments. Is that still the case, or has it changed?
Yeah, on the NHS. Yes. Okay. For the 12 months, so during your pregnancy and up to a year after you've had your baby, you are entitled to free only on the NHS, because if you go to a private dentist, you will pay.
Yeah. Okay, great. I think at those times I utilized that opportunity a lot. So wonderful. Thank you. Okay, I don't know if talking about insight into financial aspect of dental career. Are you able to tell us if I say the question? Okay, let me read the question. Can you provide insight into the financial aspects of a dental career, such as the cost of education, earning potential, and potential for student loan repayment? Is that your field? Or
Yeah.
can you give
Yeah,
a rough?
well, I guess it's like any university in the UK anyway. It's like any
Yes.
university career. The only thing is with dentistry, instead of 3 years at uni, you're spending 5 years.
Really?
So if you are, yeah, so if you are, so you're going to be funding your university
Mm,
degree for 5 years. So whatever they're paying in the UK that people pay undergraduate as a UK citizen, because there's also foreign student fees in the UK is different
yes.
from
Yes.
British citizen. So whatever it is you're paying, it's going to be for 5 years that you will be paying it. And like with any other degree, you get student loan, you know, you get your loan for your school fees like any other degree, but just know that it's for 5 years or 3 years, in the UK. And earning potential is good. It's we need dentists in the UK, so
Starting rate.
you come out, you will get a job. So that
Mm.
is, you come out, you get a job. But it's not like a standard pay for everybody. It depends. If you are a hospital, if you want to go into the hospital side of things, because
Mm.
there are hospital dentists as well, just like you have GPs, you have doctors in general practice, you have hospital, you have hospital dentists as well that have that earn like your F1, F2, so they have the basic salary. So that's pretty much standardized. But a dentist in general practice, it depends on how many patients you see. It depends on the contract you go into. It depends if you're NHS or private. So it varies. It varies. But as a new graduate, the first order you have to scale or decision you have to make is, do you want to go via the hospital route and become a consultant, or do
Yeah.
you want to go into general practice? If you want to go in general practice, then you have training. In that case, you're salaried for that 1 year of vocation training, and then subsequently, then you become more or less, if you're in general practice, you become more or less self-employed, because you earn what you do. You don't get
Yeah.
holiday pay or anything like that.
Wow.
If you're in general practice, you earn what you do. If you go on holiday, you're not earning. The only people that earn salary, post BT, are the community dentists.
Mm.
So they go into the special care. So they're into special care dentistry. So they are salaried because they're funded by the government. But in general practice, you pretty much are self-employed. You earn as you pay, as you go.
Mm.
So you have to have that in mind. So if if you want to earn more, then you either do more hours, see more patients, work more days, that sort of thing. So yeah, so I would say that is a profession where you will not be out of a job. You won't be going on the street looking for a job. There's job ready. It's just how you're able to, yeah.
Okay, so is that
I don't know if that
okay?
answered all the.
Well,
Pardon?
I guess people want to go into, they'll have to do more research online to see the current pay
Yeah.
and all of that. But it seems there's a shortage of dentists in the UK. Is that correct? Or because I keep seeing
Yeah.
um vacancies
Yeah. There is. There's
and they're not
always.
many.
Yeah.
Well, people wait for sorry, people wait for
There's
like
always a
hours.
shortage of in healthcare.
Okay,
In the
general.
UK, there's shortage of professionals in
Okay.
healthcare, and dentistry is no different. So there's shortage of dentists, there's shortage of dental nurses as well, hygienists. We could do with more.
Mm.
I don't want to say there's a shortage, because some might now ask me, where did I do my research? But we could do with more. We could always do with more dentists, more hygienists, more dental nurses, and yeah,
Yeah.
more healthcare profession. You
Yeah,
need more.
I know it's better with if you're looking for a GP, but if you're looking for a dentist, you relocate into a place and a new area, you're looking for a dentist, it's like you're on the waiting list for I don't know number of months and almost years. At least someone has told me, they couldn't get, they had to go travel somewhere else to get a dentist. And so anyway, yeah, I think there's a bit of, if you ask me, or maybe there are not many dentist is it practices you call it now, dental practices around as much as general GPs. Well, of course, it's understandable. That's
Yeah, because with dentistry, there's a lot, it takes a lot more to set up. Like I said, dentistry is a surgical discipline, really. It's a hands-on, op-tech discipline in that sense. It's a hands-on. So for a GP surgery, you can start a GP surgery, you have the GP and the chair and the SFIG. And pretty much, and the SFIG, people even have the SFIG in their homes. Whereas with dentistry, you need a dental chair that can cost up to like £70,000 to get a dental chair. So by the time you want to start putting up a dental surgery, you can't have a dental surgery with just chair and table and a few things. No, you've got to get the chair. And it's not just the chair. Then you have to have compressor. You have to have x-ray machine. X-ray machines cost around about £4,000. Then in this day of digital, you have to have a scanner. A scanner is probably around about that £4,000 or £6,000 on top of all of that. When you've got the 7,000 chair, your 70,000 chair is not going to work without a compressor. You have to get a compressor. You have to get a chair.
What?
You have to get a lot. You have to get quite a lot. Yeah, well, it depends on the kind of chair. It's similar to cars. You can get a car for, but yeah. But with dental chairs, new ones, you're looking at, I think the minimum out there for new ones, you're looking at, especially now that things are even, let me talk about when inflation had not gotten as crazy. That's about in 2019. You're looking at 20,000 at least, or 16 at least for a good, decent brand. And it can go up from there, to that amount for one. And if you enter a dental practice, sometimes you find 3 rooms. So just picture how many and how much it takes to kit that up. And if somebody wants to start one and kit it up, it means it's getting a loan from the bank or something to kit it up. And then you're now looking to get people to come and work there. So hence, to get that many people in the chair, whereas in a GP surgery, you can have up to 10 GPs working in an average GP surgery.
Yeah, right.
You don't get that with dentistry. You do get dental practices where they have 10, but they're few and far between. What you get is 3 chairs, 4 chairs, 2 chairs, 1 chair. Because for you to get 10, you're looking at a massive building because you need room for those chairs and a lot of money. So, yeah.
That's why you guys charge us a lot when we come for when adults come.
It is an expensive profession to fund.
It is.
And then we buy materials. We buy materials. Where with GP surgery, they don't buy. They might buy, but
thermometer.
You buy material. There's something we call consumables, and
Yes.
they're not cheap. And you consume them every day. The beep that you put on your patient, the beep they put on you when you go, we have to buy it, and it's disposed, and we have to put it on every single patient each time they come. It's a must, so things like that. The gloves we wear,
sterilizing of the instruments,
exactly. The sterilizers, the autoclave. I haven't even talked about autoclaves.
And the one that goes, is it air into your mouth to dry up saliva or something when they're...
So we have a lot of consumables. On one patient that comes even for a simple checkup, the consumables that they would go through, cotton roll, cotton, is there. Then simple clean, the consumables that go on that.
Yeah, it's understandable now. At least you've enlightened us. Thank you very much. Before I go to the last two questions, I'm wondering, for those coming from outside the UK, because I know UK has got its own standards and everything, and you've mentioned a lot of technology related stuff in dentistry, advancements in dentistry. And I'm wondering, people coming from Africa, let me say Africa, rather than specifying a country, what would they need to do to fit into the society if they're dentists?
Okay,
So
so
not,
you
not
mean
to society, I mean into the profession. Sorry, I rephrase my word.
dentists? So dentists
Dentists
are
from outside the country.
qualified. They
Yes.
need to take exams. So first and foremost, you need to check with the General Dental Council. The General Dental Council is the regulatory body of dentistry in the United Kingdom.
Okay.
So you need to check with General Dental Council if your school, your university is on the list of people that can convert to the UK, because not all universities are allowed to come, for their graduates to come and convert. So you need to first find out if your university is part of the university that can do that. Once you find out that yes, it is, then you need to enroll for exam to convert. So you need to do a conversion exam to convert from your degree in your country to an UK equivalent, so you take those exams and they have different parts. The exams have changed over the years. The one I did was called IQE, and we had 3 parts in the exam. The current one they have right now is ORE, and I think ORE is 2 parts now, but they're thinking I've heard that there's a debate of maybe they should turn it into 3 parts, or maybe they should change ORE again. But they have exam. General Dental Council, just Google GDC, General Dental Council, and you have information on converting from your foreign degree in dentistry to the UK. And once you sit the exam, then you're now eligible to register as a dentist on the General Dental Council. You pay for those exams. They're not cheap, and you study for the exam. The exam, you will get the curriculum of where to study. When I did mine, it would you do exams, test you on what you did in preclinical years in medical school in Nigeria, your anatomy, your physiology, you get tested there. Things that I did years before my first year, you get tested there. Then you get tested in your clinical dentistry. You get tested in every area, emergency, your basic life support, things like that. You get tested in that. So yeah.
Wow. Okay. So for those whose universities are not on the list, they have to do another first degree, or how does it work?
Yeah, if they really want to do dentistry,
You
then
just
they'll
have to
have
start
to
again.
come and study dentistry. Yeah, come and study dentistry in the
Oh
UK,
my
which
goodness.
it sounds bizarre, but yeah.
All right. Okay. All right. So those of you wanting to convert or relocate and continue your profession, you've heard it all. Thank you. What are the ethical considerations and responsibilities dentists face in their practice? In your practice, what are those ethical considerations and responsibilities you face?
Ethical. I think the bedrock of any healthcare profession is ethics. You have to be an ethical dentist. You have to be ethical. Your first thing, there's something called the Hippocratic law, or that we swear oath. The Hippocratic that every, doctors, dentists swear it when we graduated and we were doing our induction. You swear. And one of the lines there is, first, do no harm. So do no harm to your patient. And you have to be someone that have that high level of integrity. Like I said before, you have to be ethical to know that whatever it is that I'm doing, do I have you have a duty of care to your patient. So the first thing in your mind foremost is duty of care, as opposed to how much money am I going to make or not make, or am I seeing enough patient, or it's duty of care. Am I failing this patient, or am I, what am I doing? Also, you have to you have to also make sure that you're doing no harm. The treatment plan or whatever treatment you're doing to the patient is not going to be harmful to them. They're not going to be worse off. You're making sure that you carry your patient along. You get their consent before you treat them, and the consent has to be informed and valid. You get informed. Informed means your patient knows what they are getting into. It's like you're signing a contract, right? And you know the kind of contract you're signing. You've got to sit, and say, for you to sign a contract, you want to buy a house or whatever, you know it. I know that a lot of, phone companies and all these things, they have those little tiny notes at the bottom of the discretionary disclaimer note kind of thing. You can't have that in dentistry. Yours have to be bold, big and bold. The patient has to know exactly what they're getting into. You have to tell them the pros and cons of the treatment. There's no one thing fix it all in dentistry. I tell my patient, there are always options. There are always options. If you have anything and there's a treatment that you need, there are always options. You have treatment options, and you have to give your patient the treatment option, even if it is one option that is viable in that situation, or even if it is one treatment that is viable, there are two options in that case. That means either this viable treatment or do nothing. You always have to give your patient that option to do nothing, because it's their body. They can choose. You can tell them, oh, you need a filling. There's nothing else. You need a filling. But they can tell you they don't want it. So you have to put that on as well. So always informed consent is about giving your patient options, telling them the pros and cons of all the options. Every option has a pro and con. There's no perfect option. Has a pros and cons. You have to give it to them. It might seem like an overload sometimes, but you have to. And that's informed. That means they're informed. They know all, you've given them the information. And it has to be valid. Your consent has to be valid in the sense that you have to make sure that the patient has the mental capacity to make that decision. There are vulnerable patients, that for whatever reason, they can't. Patients with dementia, for example, Alzheimer's and things like that.
Yeah.
They might not have the mental capacity, and if you're doing treatment and you don't obtain that, then your consent is not valid because they don't have mental capacity at that time and you haven't informed them. So, and children as well comes into play. A 3-year-old cannot consent for themselves, so the parents have to be. So you have to get informed consent. Like I said, you have to do no harm. Don't fail in your duty of care to your patient. Get consent, inform your patient, give them pros and cons of everything. So those are the ethical, far above, whatever you're going to get paid for that procedure and everything. So that is not the first thing on your mind, or the forefront of your mind. Is the patient care first. You put their care first.
Yeah, thank you. That reminds me of a recent trip to the orthodontics for my daughter. She just had braces a few weeks ago, and they were like, oh, because I was like, oh, why not take it now? Because by the time you're 18, you won't be able to. You have to pay for it. Yeah, the doctor was. The dentist was like, even I as a parent can't take that decision for her, saying take it. It has to come from her. And I'm like, okay, so I was trying to put sense into this girl. I hope you know why, because she wouldn't want normally, because it's a hidden thing. It's not not visible. It's something hidden somewhere that needed to be done. And I was like, I hope she's going to be sensible enough to make the right choice. So yeah, but good enough.
Yeah,
she did.
with healthcare from age 16.
Yes,
you can so you can from that age. So it's no longer about your parent. Mommy said, and orthodontics is something that the patient has to comply. There has to be compliance from the patient.
Yeah.
So the patient has to be cooperative. They have to want it to do it. Otherwise, they will not be compliant.
Yeah.
And because it usually takes months, sometimes years, to do orthodontic treatment. So you need your patient's you need your patient to want to do it, and you need them to be compliant. You need them to want it to,
Yeah. So, do you have any tips for before the last one? I know we're running out of time. Just for those who like I said, my daughter just had braces, and one of the fear was, oh, you can't eat certain things, or it discolors the tooth. Things you read from social media, different people's experiences. And I'm thinking, is that true? Is that not true? So what would you say to someone who needs braces and who is meant to take braces but is maybe fearful or Well, so what are those things they need to consider before taking braces?
The thing about braces is that because it's not in most cases, not in all cases. In some cases, you really, really do need it but in most cases with braces, you can function without really having them,
Mm,
a lot of the
yeah.
time. So it becomes very blurred. So it's not like you're in pain and they say, oh, orthodontic treatment is what is going to relieve you of the pain. No. So people tend to kind of make it like downplay. But there are cases where you really need orthodontic treatment. If you don't have it, it can affect maybe your cleaning if you have crowding, you
Mm,
know, and things like that. So what I would say to people is, one, if you're in doubt, if you have any worries, because there are so many questions and so many worries, you can take it up with your dentist so that you can understand it more. But one of the things you have to realize with having braces, and nowadays there are different types of braces anyway. We knew the train tracks, the days of the train tracks alone are far gone. So there is train tracks. There is also the Invisalign type thing, the clear aligner
yeah.
stuff. So it has to be oral hygiene. When you're planning to go and have braces, you have to think you're going to have to step up your brushing,
Mm,
cleaning your teeth, because you've got a wire, especially the fixed braces, which
yes.
people call train tracks. You're going to be eating, and things can get caught in
Yeah.
between underneath it. You have to find a way of cleaning it properly, and which you can do. You should clean your teeth anyway. You should
Right.
clean your teeth properly, even without braces. So it's
Yeah.
just, someone telling you to step it up a bit. But there are clear aligners as well that they're removable, where you can remove and clean your teeth. Those, makes it easier if your treatment can be done with clear aligners, because different treatment modalities will be done for different, cases. If it
Mm,
can be done, then you would do, you can then. But cleaning is a big deal. Maintenance, if you're using the clear aligner ones where you remove and put back in, you've got to be committed to wearing it, because you have to wear it for a minimum of 20 hours a day for it to have an effect. So you have to be committed to wearing it. There are train tracks braces that they would say, put this elastic on, where you have to be committed to doing it, cleaning. But I would say to someone who is thinking and wondering, especially children, that if you're told by your dentist that you need it, then
mm,
consider having it. If the things that are putting you off is the cleaning, then think about it and try and step up your cleaning, because you should be cleaning your teeth in the first place. Because I see patients who come to me as adults and wish they had had braces when they were younger,
like me.
because now they're now they're conscious of their teeth, their
Yeah.
smile, and all of that. Now they want to have it done as adult, which you can do. You can still do
Uh,
that.
expensive.
Yeah, but yeah, so I would say, if you have any specific, there's so many questions, but if you have specific ones, ask your dentist. If you've been referred to an orthodontist, ask them. They'll be happy to answer your concerns. But I think maintaining good oral hygiene whilst you're wearing your braces is a major one. And
Yeah.
then being compliant to the instructions. When they say wear this aligner for
Mm.
all the time, then wear it. Don't forget. When they say uh, put this elastic band on, then don't forget. Yeah.
And I learned it's never too late to do this corrective surgery. Like, for someone like me, they'll say, even yes, these two are, not well aligned, that yes, it can still be done. And I'm thinking, oh,
Yeah,
like,
yeah,
is
you
that,
can do it.
oh
I've got
my
patients who
goodness.
are in their 40s and 50s aligning their teeth. Yeah, why not? You
So,
can do it.
it feels like, because then that means you'll have to loosen some bolts and nuts somewhere and then get it. Yeah, I feel, I
You're
don't know.
you're
Maybe not
overthinking it. I
get
always say to my
negative.
patient, don't overthink it. Let your When you go to a restaurant, do you sit down whilst you're sitting out in front of that lovely steak and think, oh my goodness, so they had to put a knife or they had to sting this. You don't sit down and say, oh, so they went and put the hook inside the river to catch the fish. You don't do that. You sit down and you enjoy the meal. So why are you thinking, oh, so you have to have open, bolts and everything? You just don't even overthink it.
Okay. Okay, you hear, for those who really want to do it, please go ahead. As long as you've got the means. You can see now that dentistry is, the procedures are very expensive because the offices are expensive. So you understand now why they charge us a lot for adults. Okay, finally. Thank you very much for being here. And this is where I would like you to have a heart-to-heart talk with people. I'll take myself off the screen so you can have a heart-to-heart talk with them. Do you have any additional tips or insights for someone considering a career in dentistry?
Yeah, I would say dentistry is a lovely career. I enjoy being a dentist. I love being a dentist, and I want more people to join the fold. So it's a fantastic career. It's very rewarding and very satisfactory, especially for people who love to do things with their hands. And if you want to have a career in healthcare, if you're someone who is good in science, you're science based, and you want to have career in healthcare, taking care of people, but you're also very creative and you like working with your hands, then dentistry is the career for you. Go for it, I would say. Also, I wanted to say to our people, especially the Black community, please go and register with a dentist. It's a passion of mine to encourage our community to go for routine checkups. Don't wait till you have a toothache. Go for routine checkups because things can be spotted in your mouth that might be going on in your body, and you can't see. You can't see your mouth. Your mouth is not like your hand that you can look and say, oh, what's that green thing in my hand? Oh, I better go and see the doctor. You don't see what's going on in your mouth. So please have a routine checkup with a dentist and keep your oral health in good condition, because it can affect your heart. Yeah, oral health affects the heart. It can affect, like I said, is linked to diabetes, heart disease, and things like that. So please go.
Thank you very much. We're very, very grateful for educating us, and especially that awareness about you spotting a chronic disease or a complication in the body system through the mouth. That is new to me. So thank you very much for teaching us about this. And we know it's culturally based. Until you have a headache, you don't go, well, not a headache now, toothache, you don't go to the dentist. But here we're being told today, creating an awareness that we need to do a regular checkup with our dentist. Thank you very much, Dr. Sijuwade, for coming here to educate us.
Thank you for having me.
Yeah. All right. So I'll let you go now. Thank you very much. And I'll wrap up. So viewers, you've heard it all from our beautiful dentist. She's just told us tips. So if you're here, you're just joining halfway, rewind and watch from the beginning what has been said about checkups, about the career, about how long it takes to accomplish, be a dentist, and all of that. So please watch, rewind, watch, share the video, like, comment, share, and it will be nice to spread the word around. Let us all go to our dentist. Book an appointment today with your dentist just to see what is happening. Hey, that thing that you're complaining about in your stomach, that gastro, whatever it is, might actually be spotted from your mouth. That's what we've been told today. So thank you very much for listening. Thank you for coming here. And I wish you all the best. Bye. Till we see you next time. Bye.